difficulties, just please feel free to write in the chat. So Assalamu alaikum, everybody, and welcome to, I think, the fourth now of our monthly EMPART stakeholder gatherings. It's a pleasure to have you all with us, and lots of people to thank, so I won't go into that, but I want to especially thank our distinguished speakers and guests for today. If you are new to the EMPART project, please let us know in the chat and we'll send you more information. We'd love to continue building our sort of connections and relationships to make the Muslim community and the broader Chicagoland communities healthier, inshallah. We'll start off. The agenda for today is that we'll have a short dua, and then Sister Fatma will present our distinguished panel. So I think Brother Steph, would you, as usual, do the honors?
I would be honored. Assalamu alaikum. Good afternoon, everyone. So I'll get us started. With the prayer for today, as it is displayed on the screen. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. So first I'll read the Arabic and then the English. اللهم إني أعوذ بك من الهم والحزن وأعوذ بك من الفقر من العجز والكسل وأعوذ بك من البخل والجبن وأعوذ بك من غلبة الدين وقهر الرجال. O Allah, God Almighty, I take refuge in you from anxiety and sorrow, and I seek refuge from weakness and laziness, and I seek refuge from miserliness and cowardice, and I seek refuge from the burden of debts and from being overpowered by men. Ameen.
Thank you, Brother Steph. And we'll now turn to Sister Fatma.
Your mic is off. Okay, assalamu alaikum. Do you see this now?
Yes, I guess so.
Okay, perfect. Thank you again, Nabil, for getting us started, and many jazai khairan, Saif, for your duas. Saif is our official khatib, and he brings the duas to us for all the different meetings. And every dua, every prayer really has an intent behind it. So we add that intent and we begin with that intent, begin with that intent so that we succeed in our actions. And in fact, today's meeting is actually all about that entire process. So we're gonna follow through. Some of the guests are actually new to this platform. So I will begin with a little bit of the format. As the purpose of these monthly meetings, as you know, we take one particular PCORI principle and we explore that principle along as we go on. So there are 6 principles. This is our 4th in the row, and we have 2 left that we would finish before Ramadan. Then we would have our guest speakers, and today we are actually would be adding the subject matter experts to our project, inshallah. And then we want to leave as much of a Q&A session as possible at the end of the meeting, so people can openly ask questions. And there are certain things that I would be zipping through, and so that we can leave the time for the end. The background and introduction, there are many links that are available on our website, and I would encourage every one of you to actually go to the website and explore those links. We began back in 2017 with Engaging Muslim Americans for Research in Community Health. and that was a PCORI funded project. We came out of that project with the Mask PCOR toolkit, and today this particular project, the EMPART project, actually is the dissemination of the Mask PCOR toolkit that was created back during the previous project. So we are looking forward to actually have a conference in the September of this year. We actually had a Mask PCOR conference, the first conference that happened back in October 2019. And this year, again, we would like to have another conference. It would be a 2-day symposium, possibly virtually, possibly a small gathering, don't know, but we really wanted to have a large symposium, which is not possible due to the lockdown. However, we would try to do very best, and we want to continue this tradition of having the PCOR conference every 2 years. I don't know how this is going to happen. I'm adding that intent, and I'm going to see if Allah subhanahu wa ta'ala wants to make it happen. It's going to happen, inshallah. Okay, so just with the recap of the timeline and the current status of the project, we are now we actually started with recruiting the community health workers. We trained them for over a period of 1 month. Dr. Rebecca Johnson was actually, and Dr. Basim Patela was both a part of this training. And we trained 10 community health workers on the PCOR and the Mask PCOR toolkit. We're now doing we connected or engaged about 5 mosques through this process. And now we're conducting the outreach. Our outreach is actually virtual. It's called VirtReach. And hopefully we would like to gather some data about the Muslim health needs or mosque community needs. And we would be presenting some of those data at our town halls. And we've picked out about 5 different topics for the town halls. We're hoping to have these town halls back in June forward in June and July. And then, of course, the toolkit, the conference. Okay. So PCORI engagement principles, as I mentioned, we are going to talk about the principles, and in particular on transparency. This particular document, I have added the link at the bottom here. Please look at these documents. This is one of the major documents that PCORI runs on, and it's the engagement principle. This is a 7-page document, but really is a roadmap for how to engage community members and how to, in fact, be funded from PCORI for the community engagement grants and programs. So we're actually working on transparency, honesty, and trust. They have lumped it together as a one principle, and they do work hand in hand. But these are such loaded and huge topics that we have decided to take them step by step and move forward with each topic each month. Masood, I'm going to just interject. Luma Mahari has texted me that she has not received a link. So can somebody please text her, Luma Mahari? Okay. PCORI claims clarity to be the single main caveats for successful engagement. And really we can, in fact, today we would explore how that is indeed possible. Successful engagements, really, if we take that step backward, clarity, we need clarity in our intent, we need clarity in actions, and we need clarity in the message. That really transformed to a successful engagement. And but it's not easy to get clarity. That is where we all struggle. And people who do provide marketing or information systems or communications, they know how much it matters. Each word and the place of each word, even the silence and the pauses between the words really counts. We actually talked a little bit detailed about the active listening in the past meeting. And if any of you would like to go back, you can review these online on our social platform. But talking about clarity in engagements really comes in from these 3 separate items or behaviors and we will explore in a little bit details. So when you put clarity, or when you try to do transparency with the healthcare system, this is what our healthcare system looks like. Now, trying to find transparency in this system, it's like, where is Waldo? But I must say that the price that we pay for our healthcare today, this system must work for us, and it needs to work for us the way we want to make it work. If I like to have a particular treatment option, I want to see how can I get it. So today we would talk in detail about these things, and we need to, from the individual level all the way to the government level, this transparency needs to be there in order for us to work. If you look at this particular chart, you see physician, you see president and Congress on the top levels, and you have you would have the physicians and patients on the bottom. So I'm going to move forward. Systems complexity increases from individual to government, and this is where we have need for on one hand, from when you look at the government side, you see the need for accountability, and that needs makes the government responsible for these things. So they are the ones who are responsible to do the accountability, to have the accountability embedded across all of these systems. However, we as individuals must focus on systems literacy, and that would bring us, or that would take us to the larger system. And in fact, that between the two, transparency is really a two-way street. The need for increased capacity for systems literacy is our responsibility, but the need to decrease complexity through the accountability is the government's responsibility. So today's question becomes how to create transparency by increasing systems literacy at organizational and individual levels while holding the authorities accountable for our community's needs. So in order to explore this question, we have 4 guests today. Once again, we have one of our very distinguished scholars that we have among us today is Dr. Amina Al-Din. The materials that I've sent out, there is a long bio that I have for her, and I'll talk a little bit more about it. But she's going to talk about how as patients, caregivers, and community-based organizations can come together and synchronize our behaviors to demand a transparent healthcare system. Then we have Hira Mirza. She's a subject matter expert, and she would talk about faith-based engagements and what the government is doing with respect to the faith-based engagement and faith-based neighborhood engagements initiative, and their role in connecting grassroots communities to the government structures. We have Dr. Kamal Adrawi he has many roles as a community leader, but we're bringing him in today as a subject matter expert because he really truly leads the community with respect to community health and brings all of these different facets together in a beautiful way to develop community health programs, platforms, programs, and projects. So Luma is calling me. I'm so sorry. Okay. Somebody has to send Luma Mahari a link, guys. And
I'm sending you right now.
Okay, please. Or you can call her and talk to her too, Basud. Okay, so Dr. Kamal is going to be talking to us, and he's going to give us a specific example on how the CIOGC's COVID task force helped mosques to be transparent to the government structures with respect to religious practices, because there were a lot of questions. And then they also brought resources to sustain the socioeconomic cycles that exist today in our mosque communities and sustain the Muslim communities across the greater Chicagoland area. They have done a phenomenal job, and Dr. Kamal is going to share with us today how he has made it possible. And then we have Brother Imran Khan, and he is an expert in cloud systems with Amazon Web Services. He's got an extremely long. When I was reading his bio, it sounded like I'm reading a surgeon's, a medical procedure that did not make any sense to me, even though I've been in information systems. But that's the kind of need we have to bring into these even though it seems like really small projects, but these are the kind of experts that we're going to need in order to create that transparency. And Brother Imran will actually help us today in deciphering how information systems can create transparency for the not-for-profit sector, and how the nonprofit can take advantage of some of these offerings, or they should partner with the subject matter experts like him. There are many people in our community that are information systems experts, but they are extremely underutilized. And we need to bring these kind of expertise into our nonprofit sector. Okay, so just a little bit about Dr. Amina Al-Din. She's a professor emerita of Islamic Studies at the Department of Religious Studies at DePaul University. In 2006, she founded the United States' first undergraduate baccalaureate program in Islamic World Studies. She's the former editor-in-chief of the Journal of Islamic Law and Culture. Her book publications include African American Islam, Questions of Faith, Translational Muslims in America, Introduction to Islam in the 21st Century, Global Muslims in the 21st Century, History of Arab Americans, Exploring Diverse Roots and Muslim Ethics in the 21st Century. So we have a wealth of experience with her today, who's going to guide us on transparency in healthcare, guys. And it's actually at the individual level. So each one of us can take a lesson for our own selves. She's a Fulbright scholar, and she actually hosts a critical talk show on the Muslim Network TV. It's a Muslim Network TV production by Sound Vision. So she's there twice a week, or I believe three times a week. I have been on her show once, and it has been a pleasure talking with her on those shows. She's also an editor for the Brill Public Publishers, and she's also an editor for Anthropology and Ethnology Open Access Journal. So with any further delays, I'm going to go to Dr. Amina's transparency talk in healthcare. Okay. How do I
can't help you.
I know. Open with Google. That's what I should do, so that everyone can see it on a big screen or a bigger picture. Oh, there it is. Present. That's what it is. There you are, Amna.
I don't see a thing.
Oh, you don't see a thing? Okay. Okay. Let me see this. Let me do this. Can you see now?
I can see it.
Perfect.
Who can see it?
Oh, you cannot see it.
Nancy, yeah, I can see it. From the beginning, though. Everybody else? Maybe that's...
Can you guys see?
I can see it too.
Okay.
Well, doggone. I can go where?
Dr. Amna, can you see me? Or can you?
Can you make her host, maybe?
But then she would have to have the...
I can see it when I pull it up from my end.
Okay, so can you become a host?
Work. Yeah.
Huh?
Can I make you the host?
Sure.
Okay, so I'm going to stop presenting.
Okay. Oh,
and can you... So you need to go to present now and say present your entire screen.
Do what?
On the bottom right corner of your screen, you probably have this present now. A link.
Your entire screen?
Might
Yeah.
Share screen.
I need Imran to talk with me later. As I learn how to swim again. Okay, present my entire screen. Is that it?
That's it.
And this or this? Which one do you want? That one?
But you can you can open up your
It's there. I opened it. Can you see my screen?
No, you're not sharing it though. So you click on the share, which screen
No,
you want
were
to
supposed to do this. You're killing me here. I did. You can see it. See? Share. Okay.
and then say share.
No, but it says can't share your screen. It might not have screen recording permission on your computer. So you're going to have to do it, dear, because you're recording.
That's fine. Sure. Absolutely.
Where's Imran? Imran, help her out, please.
Okay. Can you see it now?
Nope.
You cannot see it. How is that possible?
I don't know.
I don't
Okay.
see it. I don't see it either anymore.
Oh, I see. I know why.
You have to present that.
Yeah, I have to.
Yeah. You know, I'm just going to share my. I'm going to share my entire screen this time. And this should be able to help you see it.
I can see it then. Oh, that was cute.
Okay. Can you see it now?
Yep.
Okay. Very good.
Oh, this has been such a journey. Assalamu alaikum, and hello to those who are not Muslim. This is an honor. And before we get to the slides, quickly I want to say about something about transparency. Everybody wants to claim to be transparent, and then they use $100 words that nobody can understand. So in effect, they're not transparent. The other thing is with respect to the Muslim community, and since 9/11 and before that, 1984-5, the Muslim community, which most of the time thought of itself as transparent, has found the demand for transparency hard. I would just say hard. So convincing many of our communities to give up everything about themselves is difficult. But what we can do is kind of make a quid pro quo. Can you go to the next slide? So transparency technically talks about I can shine a light through whatever it is, and I can see what's behind it without any cloudiness. So it requires a clarity of explanation. And I found, even in reading Picori's documents, and I read well, I thought, till I opened up Picori's documents, that sometimes we have to take what's there and put it in plain, simple language for people coming from many areas, and not just constantly rely upon what's there. When we talk about systems, what do we mean? Fairness in treatment, and clarity of explanation are both two-way streets. Honesty and explanation is a two-way street also. And accuracy and explaining facts, all of these are two-way streets. Healthcare providers, along with the systems that support that healthcare, have to be and can only be as clear, first, as we demand of them, but second of all, how much accurate and clear information we give. Let me give you an example. An insurance company will send you documents in print. I have to pull out my magnifying glass to see, because all of the important stuff is teeny tiny, always. Employers, that's a little bit of a different thing, but they are the physicians, the managers, all of the people that go in, the administrators that go into supporting a hospital or a clinic. But if you notice, patients are in the center. The people on the other end don't have a job unless it is patient-centered and what patients demand and what they get. Healthcare professionals, some of them are good and some of them are not so good. But we have to learn how to differentiate, meaning distinguish between the really excellent physician and give him or her some kudos. My favorite are nurses, give them some kudos. And the policy makers, we have to make our voices heard. Next. So, making informed choices. I, as a newly retired person, found that one set of the most difficult choices I had, the first end was getting hired, and the second end was retirement. When everybody and their relatives will send you stuff in the mail, sign up for me, oh, we do so much better. It's Humana and I don't know, Blue Cross Blue Shield, and this plan and the other plan. We're bombarded on the TV with plans. The average person, and I include myself as one of those, cannot decide. We need help. You've got to go and get some help on deciding which healthcare plan is for you. You can't do that without some clarity and some honesty about what you need. Okay? So again, it's that dual thing. Choosing a hospital. You have to choose hospitals as close to you as possible, but those that are clean, those that have a variety of services, those that have labs on site serve you best. If you're going to a clinic and you're not quite ready for the hospital, clinical practices, many of us in the Muslim community try to choose Muslim doctors. My thing says that's good and that can be not so good, but it depends. If you question them and do some inquiry, and we'll get to that, then you will know what practice is best for you. Alternative treatments, many insurance plans are just now beginning to cover things like acupuncture, massage, but also alternative treatments can be physical therapy. So you need to make an informed choice by being honest about what your needs are. Can we go to the next one? You also need to ask about copayments. You need to see what's covered. I just found out I'm not covered for, dental. And I was you don't want to know what I said to Blue Cross Blue Shield. But nevertheless, you need to find out what's covered, what's not. What are your deductibles during a year? Is it an annual enrollment, or do you only have to sign up once? Many people have lost insurance because they didn't realize they needed to sign up during that, I forget what you call that period that happens somewhere between December and January.
Enrollment period.
Say it again?
Enrollment period.
Well, thank you, Imran. I'll need you later. That enrollment period, and we don't pay it any attention because they say, well, I already enrolled. But it becomes our responsibility to know when that is. Prescriptions are an interesting batch of stuff. When I used to practice pharmacy, we actually came from behind those counters and talked to patients about what they were taking. You know, we kept legends of your drugs. We looked at what doctors were prescribing. Sometimes we had to call the doctor. Now our buffer is the pharmacy technician who doesn't have all of that information, just hands you a bag, you go away. You've got to look and see if it is what was ordered. You've got to ask questions. Medical devices are another area where you've got to look and see what your health insurance covers. You might be surprised that it covers more than you thought it did. Additional in-home service, in-home nursing, physical therapy, transportation, all of these things, especially in the Muslim community, require some thought. You don't want in-home nursing by just anybody. If the person who is ill is female, you don't want her nurse to be male because of the things that have to be done, and vice versa. So you want to take into considerations some things you have to ask for. And other people in other communities ask for them all the time. If your health insurance provides transportation. Can I go to the next one? So, what information should be available about your healthcare provider? What type of patients do they serve? What type of insurance is accepted? These are questions you can get answers to largely on the phone. How is the facility and the professionals rated? There are now several rating systems that you can have access to. And you need to pay attention. Just because it's close, if its rating is 2, you say, that's wonderful. I will wave to you as I pass by. You have, what rights do you have as a patient? Clinics and hospitals should have brochures that talk about patients' rights. They used to have departments which were dedicated to where patients could complain. Find out where it is. What type of services are provided? If you're going to a clinic that has to send you out to 79 different providers for all that you need, you may want to look into a different clinic. And then it's how you will be billed. It's nothing more frustrating than getting a bill from a doctor you've never heard of. And you're sitting there, well, where did you come from? What did you do? Put the Band-Aid on? Where did you play out in this? But you have to ask. Don't let anybody send you a bill that doesn't have what was the service provided. Next. Before the appointment, and this is not on this list, but I think it's very important. Write down all of the medications you take, their doses, and how many times a day you take them. Then secondarily, write down all of the vitamins and auxiliary medications that you take. And that includes food supplements, which you perhaps in some communities have eaten all your life and don't consider it medicine, but know it's good for you. But write them down. And then look at the ease of scheduling an appointment. If you call to make an appointment and somebody's harried by you calling, in your head, you got to say, you wouldn't have a job if I wasn't calling. So try to calm them down and is the staff courteous? Is the facility clean? What is the wait time? Once you get there, are you waiting for hours to see the physician because their scheduling is not correct? During the appointment, medical professionals are tasked to be professional in how they treat you, how they handle your body or not. And you need to make demands. They need to explain all of the procedures in a way in which you can understand. Explain what medicines they're prescribing or not, what procedures they're prescribing or not. You, on the other hand, have to be clear on what you need. If you're not telling the professional, and after you get home or on the way, I forgot to tell them that my knee aches. Or I forgot to tell them that this and that and the others have. That's not helping the professional help you. Next. I might be at the. Thank you. Did I do it in 20 minutes?
Dr. Alva, you did a phenomenal job. Thank you.
You're welcome.
Even though now here is something I got to tell you guys. This is a lady who could talk about metaphysics all the way to cultural nuances. And in a nutshell, you have simplified the responsibility of a patient.
Good.
Thank you. No, this is great. We are actually going to use your materials as part of our training, or incorporate them in our trainings as well. And some of the materials that we would do for the patients, because again, having that clarity in message is the key. So with Dr. Amina, we actually are, she summarized what the patients, or what is the responsibility of us at an individual level, and these understanding some of the healthcare nuances and the systems of healthcare, what do we need, really would build capacity on our end as to what our responsibility is. So I'm going to move on to our subject matter experts, and we're going to take this individual responsibility, and in the next 30 or 40 minutes, we're gonna take it all in full circle from the government to the grassroots level organizations. So we, as I mentioned, that from this meeting onwards, we are introducing subject matter experts. And in fact, we're hoping to put together a subject matter expert advisory board. We have talked about for many years, in fact, a community advisory board for community health. And every time we look at somebody who would really help us in the community health, we find them more often as an expert for their own field and with the least amount of knowledge on the community health end. And when we find the community health person, they don't know about anything else either. So we're thinking, where's the disconnect? Where are we going wrong? So this idea hidden, because the subject matter experts are used to create transparency in the legal court system. And what do? They bring in the most independent and the very objective opinion about whatever is at hand. So we are putting in 3 groups of the subject matter advisory board: the data and the systems and legal. So data, as to it would all about what is the data that we are collecting? Is that HIPAA compliant? Where is it hosted? Where does it go? What do we do with the data? How's evaluations happen? Is that whatever data we collected, is that telling us the truth for the ground realities? So all of those kind of questions are going to come up when we do this virtual outreach with our community health workers. Now, with the information systems, you saw the jungle of healthcare, and what jungle it is for the information systems, and trying to keep things simple in that is no layman's job. So we definitely need people like people like both Dr. Kamal Adrawi and Brother Imran, who bring in these systems and these structures together. With the legal, we are actually hoping to have some lawyers involved in this, and who have actually expressed interest in helping the community health projects out. So in the next 2, the honesty and trust, in those 2 meetings, you're going to hear from the lawyers as well, inshallah. So that's what we do. And let's actually move on. So, when we take the transparency or this individual responsibility all the way to the government level and to the policy, this particular graph really, or infographics actually really helps you a lot. This is sort of like a vision that is adopted by CDC and by Health and Human Services. And in fact, what we need to do as a grassroots, as the individual, as the community-based organization, we need to attach ourselves with this vision. So you see that the needs of the communities are at the bottom, and then comes the CIOGC task force, and then comes the faith-based initiatives, and all of this will actually eventually feeds into the policy, which would go back into back into making the legislation that would affect us in sense. I'm going to now call on to Hira Mirza. She is the subject matter expert in the health policy management. She's actually finishing up her MPH in the next few months from the SUNY University downstate, New York. And she has been working, let me actually read it. It'll probably be better. Otherwise, I'm going to go all over in circles. She's a special assistant at the Center for Medicare and Medicaid Services under the Office of Programs, Operations, and Local Engagement. In New York, in her times in CMS, she has functioned as a liaison between Medicare and health insurance marketplace plans and their enrollees. She is also involved in community outreach, giving presentations and trainings on Medicare and Affordable Care Act for community partners. Currently, she works to support the Affordable Care Act through the casework, state engagement, and issuer certification teams at a national level. And this is where all the big data is involved. For the past 11 years, Hira has worked in government sectors within Social Security Administration, CMS, and very much understand the complexities of the infrastructure. And so she's actually going to be talking about a faith-based neighborhood partnerships initiative that was actually put together in the back in the Bush administration, but it really took off in the Obama administration, but did not have much attention during the Trump administration, and now it's coming back. So with Biden and Harris administration, we are really, they have started bi-weekly calls, I believe, and they are rolling out these partnerships. So it's a really good time for the grassroots level organization like ours, Worry Free Community, to get in line with these, and we can align our efforts from the individual level now into the community and through the so you see how this is all comes together. And with any further delay, I'm going to ask Hira to go on and talk to us about the faith-based engagement.
Thank you. Assalamu alaikum and hello, everyone. So just to start on this is such a long and complex topic, and this could go on for months. But we get really caught up and we get really nervous about what we hear in the media as far as especially administrations go, and rightfully so. You know, it's especially hard for immigrant communities who feel like they're being attacked. But despite the administration, these resources always exist and they don't go anywhere. So for something like CMS, when you go on their outreach and education, their partnership websites, they're available. Their email addresses are there. People monitor those mailboxes. They aren't just there to be there. I've also linked the CDC coronavirus toolkit that is for the community and for faith-based organizations. The other thing to remember is that despite the administration, the government employees that you're engaging, at least federally, are likely to be the same for 20 years. The ones you see in the media, the politicals as they're called, they only last for 4 to 8 years, depending on the administration. And those positions are far and few. So for someone like me, I've worked in the government the last 11 years. I've been through a few administrations, and I worked through the Trump administration, but I worked with the same partners at that time, the same people. We were still helping we were still at the ground level in New York, helping the same people do the same things. And it's terrible, some of the policies that are enacted, but the people are still good. And you should take advantage of making those relationships because those people won't go anywhere. This administration is very much looking to expand its reach in low income and underserved communities. However, right now, everything that's happening is super focused on COVID-19, the vaccine, and anything related to healthcare, which is not a bad thing. You know, this administration has inherited a lot. They have a lot to do. And a lot of the outreach is being focused on communities that need it the most. I also linked the emergency information here. This is also it's always current. This is updated probably the most currently. You should have these slides so, you don't have to copy anything and whatnot. Can you go to the next slide? So as we talk about transparency, we talked about accountability, and a big part of it is engagement. And being someone who was doing outreach, what I realized the most was that the people in the government just don't know. They don't even recognize that the Muslim community has needs, or that they exist in such numbers too. And unless we engage back, they're never going to know. So I've linked here like our CMS office. If you have Medicare questions, if you have questions about the Affordable Care Act, I used to monitor our region's boxes, so I know that these are answered. But what's more important is at a local level. So you should be engaging your local congressional representative. So even in a case like a meeting like this, you can invite local congressional rep, and if they don't want to come, they are likely to send someone from their office. And they used to do that with our events too. Especially ones that we back as a community, people that we believe in, who believe in us. We want them to know that we exist, that our community has problems just like any others, and that we require support. And it's not easy, right? Always staying engaged and finding ways to stay engaged. And local city council members, local congressional reps are always having events. And even if it's once a month, we should try to set aside an hour or two where we can show up to one of these events, say something on behalf of our community, send them an email, send them a tweet. It's much simpler now. And in other ways too, when you have a problem, like for instance, when we go to, Dr. Amina was talking about just some of the problems you have with your health insurers. If you feel like they're committing fraud, go to your local Congress representative, write them a letter, tell them that you think that something's wrong. They will go to the State Department on your behalf, and they will be forced to explain it to you in a way, in plain language. And it's okay to ask these questions. That's what they're there for. People used to write to us all the time. That's almost 50% of our work, people's inquiries. And we don't take advantage of this sort of stuff, because what's important, what's also important is when you do that, they monitor trends. So if 17 of you are writing about the same issue, it'll eventually peak to them, and they'll have to take it up further. And they'll have to say, hey, this seems to be an issue in our local community. So like I said, on our part, staying engaged is part of the work, making them accountable for the fact that our needs exist and they have to do something about it. Our local government, our federal government has to do something about it. On the bottom, I just put there's a partnership email at CMS you can sign up for. And then all of HHS is on there too. And you can just take a look at the partnerships that they have. You can go to the next slide. So there's also product ordering, if you've ever seen this. There's a CMS one, you can just sign up for an account, say that you work with the local communities. They will send you products for free about Medicare, about the Medicaid. Some of them are just about health insurance in general. I hope they still have that product. There was a very good pamphlet where it really broke down everything about co-insurance, deductibles, premiums, all those things that can be really daunting, but then when you see them on paper, it's not as bad. And then I put some of the mental health stuff there, the CDC things. But really, you think about any government agency, you can reach out for the most part. And they have outreach teams too. And they're willing to come and, it's part of their job. They're willing to come and speak at events. They're willing to send you information, whatever the case is. But unless we engage them, they don't necessarily know that we exist either. So while it is on them and you want to say, they should also be doing it, and I agree, there's the sad part is they're also under-resourced half the time. And, the saddest part for me was working in the New York team. I worked in New York City, and the outreach team was entirely white. It's New York City. We're probably the most diverse city in the entire, United States. And it didn't feel like we were showing up for our community in that way. And I've expressed this, and this is known, and I know they're hiring and they're fixing this, and that's the other thing that goes to my next point. Change takes time, but voices are heard. So when you continually talk about it, when you continually make a point, change does happen. And like I said, at our level, things are changing as far as outreach goes for CMS. They are making an effort to hire people that look like the community. I just put in another issue here that I don't know how well everyone's familiar with. The Affordable Care Act had an issue with the federal poverty level. And this has been an issue since the beginning of time of when it started in 2013, that if you were above the 400% federal poverty level, you weren't eligible for any tax credits. And this has been discussed and discussed and discussed. And now it's actually going to Congress now for a plan to expand it. So it took a while. but people listened. You know, they did listen and they were aware, and we talked about this over and over and over again. So it eventually got there. So we can't give up. And that's the last point, that our strength's in consistency and it's in numbers. And what I've seen over time is there's a lack of organization. But when we're organized and when we speak up together and when we're consistent about it, that's how we get attention. Because at the end of the day, especially in this administration, as much as they want to expand and serve underserved communities, they're also bombarded with a lot of other things that are going on right now, especially COVID-19 and the health of every American. But as a Muslim community, I think it's very important that we find ways to be consistent and bind together and speak as one. That's really all I had to say on this topic.
Thank you, Hira. That was very good. And as Dr. Amin was talking about the individual responsibility and what we can do, and it all ties back to that systems literacy that we have talking about. And now I would really like to get Dr. Kamal Adrawi, who leads the task force for COVID-19 for CIOGC, the COVID-19 task force, and what he has and his role and his efforts in fighting the pandemic. So he's an associate professor at the College of Nursing at University of Illinois, Chicago, and an affiliate assistant professor at the UIC's School of Public Health. His interdisciplinary research focuses on individual and neighborhood factors associated with chronic conditions, especially asthma and vulnerable and underserved population. He has earned intramural and extramural support for his research and received several prestigious awards. Dr. Adrawi was one of just 12 nursing educators from across the United States to win a highly competitive 3-year grant from Robert Wood Johnson Foundations. And my God, these are very highly competitive, and it's extremely hard to find. But we are so proud of Dr. Adrawi's work in that respect. His work has been disseminated widely in scientific conferences, top-tier journals and media outlets, BBC News and Chicago Sun-Times. He's actively engaged with community initiatives and professional organizations. As you know, he's currently leading the COVID-19 task force and MASS as well. So without further delay, I would love to invite Dr. Kamal Adrawi to talk to us about how the task force has helped MASS communities being transparent and sustainable during this pandemic times. Thank you, Dr. Kamal. Go ahead.
Dr. Kamal, you're muted.
Talking to myself. I said, Assalamu alaikum wa barakatuh. Thank you, Sister Fatima, for these nice awards. Thank you, everybody, for having me. I'm so humbled to be part of this great effort, a great group working to advance our community and help understand the needs of the community and be transparent about it when you convey these needs to others. So just to give you some background, when we were hit with COVID-19 in late February, early March of last year, we quickly worked to assemble a very talented group of people and organizations and we formed the joint task force to really lead the community during these challenging times. We envisioned the huge needs and the amount of work that is needed to address the multitude of needs the community would have. Quickly, we launched, we called for volunteers, and we were very humbled by the outpouring of support we received from the community. In a few days, over 100 individuals and organizations stepped up and offered their services, and we started expanding our efforts as we moved forward. Now, just to go back to the topic of transparency, transparency in the context of this work basically means we have to share authentic, credible information, and we have to really we have to be humble enough to say I don't know when we don't know. We don't have the solutions when we don't have those solutions. We should be able to say that. And when we are not sure, transparency means we say we are not sure, and not to try to kind of go around it and try to send different messages. I'll give you an example. In the early days of the pandemic, in March, probably March 12th, we had a meeting with community leaders and imams and presidents, and we took the hard decision to call for recommending cancellation of services in mosques and in schools and other entities. And it was a very difficult and tough decision. However, we were clear with the community. These are the risks we are seeing. Let's discuss how much risk we can take. We don't want to make our masajid, our community centers, become hotspots of the transmission of this condition. And alhamdulillah, I think we made the right decision, and the community was very supportive to abide by those recommendations. Another example is when we developed the guidelines. We developed guidelines for closing, for reopening, especially when we were getting ready to gradually reopen our masajid. We had several meetings with community leaders, with advocates, with volunteers, trying to develop some guidelines that are very specific, culturally sensitive and specific to the needs of the community, to our masajid. And alhamdulillah, we were very transparent with the officials, with the health officials, with the governor's office, and so forth. And we conveyed those guidelines. We send them copies of those guidelines so they know what are the specific needs of the communities. And the third example I have is, as we speak, as we try to develop develop plans to increase the vaccination in our communities. We are trying to be as transparent as possible as far as what communities need the vaccination most to start with. Organizations are, they want to do things, and sometimes they're focused on their own organization. But here, as for CIRGC as an umbrella organization, seeing the whole picture, yes, we can have a distribution or point of distribution in this community. However, that community is in a more urgent need. We have a higher percentage of that community who are at a greater risk. So we don't want to compete over the site. If that community, the south side of Chicago, for example, needs it more than other parts of the city or of Illinois, then we have to be transparent about that and be clear on it about it. So that's one more thing I want to say about transparency. Intent for transparency is not sufficient. It has to be followed. It has to be translated into action. So you could intend to be transparent about what you want to do, but if you are meeting with a group that most of them are not English speakers, or English is not their first language, and here you're speaking only English and academic English, and are we really being transparent that way? They might not understand, or they might be hesitant to ask you. You are an authority figure. They would probably feel, I don't want to ask everybody else knows what he or she is talking about. So transparency, intent is not always enough. We need to make sure the language we use is at the level of the audience we are dealing, even if that means extra time, extra effort to translate, find others who can speak that language. Not only speak it, they have to be aware of the culture and the different ways of saying certain things, because you want to make sure it's understandable. This is why when we do research with communities, we need to make sure what happens when you go to the doctor's office and they give you the HIPAA form to sign, or many times actually when you go to the pharmacy they ask you to sign without giving you a form. And how many of us would stop them saying, you're asking me to sign a form I did not even receive, but I'm receiving it. That's not, that's not transparency. and they look at you, you know, in a strange way if you say that doesn't feel right. You're asking me to sign. I received this form, but you're not even giving me that form. You know what I mean? And then they tell you, oh, go to this website. So that's, you know, they want to look like they're transparent, but they're not transparent. So now as researchers, you know, and you know, my other hats, I'm a researcher at the University of Illinois at Chicago. We do research, and we have to tell people, the participants, what the research is about, why you're doing it, why you're selecting them, what are the risks involved, how, you know, what other options do they have, what do you do with their data, and what data you collect from them, and what do you do with it, how long you keep it. Are you going to keep their names next to their history of depression? So anybody who hacks the data set can find out, you know, so and so has a history of depression, and God knows where that information would go. So you tell them if there are risks, you know, there is the risk of breach of confidentiality. We're trying our best, but this is a real risk. And are you paying them? Are not paying them? Are you sharing their information? You know, what happens sometimes, community organizations ask for contact information. Are we sharing this contact information with each other? If I give it to this organization, is it going to be with every organization? We should not take these things. We should not take these things lightly. So basically, what is, and that makes a difference. That makes a difference. Another aspect of transparency is when you come into a community trying to do research, and I know this is about research, trying to do research with the community, you come to the gatekeepers of that community, you be honest about it. You tell them, you know, I'm interested in studying diabetes. I don't want to look like I'm studying diabetes. I'm studying something else, but in fact, I intend to get to diabetes. You just be clear about it, because the community's needs might be different than your needs. And maybe you're not the right person to do this research with this community. You can bring another collaborator and you can work together. You know what I mean? So basically also discuss who is, you know, who's going to own the data. How are you going to deal with the data? What if there is a report going to be published based on these data? Are you gonna just go to your office, big office or small office in an academic institution and write it up and just publish it? Or are you gonna invite are people who are part of the making of this research, of this effort, part of that publication or not? So these are very important things to discuss, and that makes a difference. Once you are transparent, you gain the trust. When you gain the trust of the community, they're more likely to let you in. They're more likely to to allow you to get the information you need. And you want to always think about what you are giving back. It's not just, people are not data points. They're not a subject ID. People they have needs. They're human beings. Are you gonna give back to the communities? Are you gonna, how is this data you're collecting and help the community get more access, have more prevention, more interventions, and other kinds of programs? We did, you know, I directed the Chicago Asthma School study, you know, when I was doing my PhD, and we collected, you know, data from over probably around 40 to 50,000 school children in Chicago. And we asked them whether they have asthma or not. And everybody, regardless whether they have asthma or not, we send them a letter back saying, based on your answers, you have asthma. You have respiratory symptoms that suggest asthma. You don't have asthma. Do you need help accessing a doctor or a clinic? Can we forward your information to somebody to help you? And so forth. Then when we went back for a more in-depth survey, selecting a sample of those, we got a participation rate of over 90%, around 91% of people that we have contact information for answered a survey over 2,000 children. We collected data from the parents of over 2,000 children with the Chicago Asthma. We did a study on asthma and immigrant populations focused on Mexican Americans. So, you know, I was told this is a very informal, so this is why I did not prepare slides. I was told I have 5 minutes. I'm not keeping track of the time. I hope I'm still within the 5 minutes. This is what I have to say. Thank you so much
Yes.
for this.
Thank you so much, Dr. Kamal. No, you did an excellent job in actually bringing out the details as to where the personal responsibility lies with respect to systems literacy and how the infrastructure of healthcare systems can be used, and bringing in that research aspect that people need to be in tune with. So going back to our uh, um, uh, our diagram here, or the vision of CDC, and connecting these structures at different levels, we're now going to focus on the needs of the communities and the Boston members. And we have seen how we have covered the faith-based initiative and the COGC task force and kind of toggle back and forth. And now we want to talk about the 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 infrastructure jungle that's out there. The healthcare system is like a systems jungle. And you see all of the little tracks that are connectors, all of that. These are the highways. And you have the buildings, you have small buildings, you got neighborhoods out here. You have the hub, the city hall as Secretary of Health and Human Services. And you have all of these different structures that are connected to each other at the different levels, and somebody needs to plan the city. This is the information system city within the healthcare system. And this is why we're going to have Brother Imran talk about, as he is called a cloud architect. That's what he is. So I wondered, why are these systems people are being called architect? And I recognize that we're talking virtual cities. Somebody needs to plan that city. Somebody needs to understand where the highways are going to be, where the bridges are going to be. And what I would like to introduce Brother Imran is that he helps create transparency and build system literacy both. And he is, let me give you a little bit of background about him. He's a senior IT professional with 25 plus years of proven experience across business technology, transformation, and program management. Not project management, program management, which is a continuation of a very long-term program. I'm sure he's a project management as well, but projects are short-term and they end. So he's a highly adaptable leader and consulting practitioner in many client industries and disciplines, specializing in manufacturing and healthcare industry. Highly technical and adaptive individual who has worked on migrations, upgrades, re-platforms, engineering big data, and moving them to public cloud. In a nutshell, Brother Imran is the person who designs the information system cities with roads, canals, and bridges, and the data warehouses. He'll be sharing with us plausible solutions for capacity building, or maybe highlighting the need for the capacity building at the grassroots levels to weave transparency that may lead to a trusted healthcare environment. So I'm going to summarize this action plan once we hear from Brother Imran. Brother Imran, go ahead.
Assalamu alaikum, everyone. Thank you for inviting me, Sister Fatima. Great to be here, actually.
Can't see him.
Can you see me? Or can you hear me? Yes, okay, cool. Asna is also here, so she's my daughter, actually, who just joined Worry Free community as well. So from the transparency perspective, I would like to say that, there's a lot of things that I talked about to Sister Fatma the other day, that, the gathering of the data, actually, right? We have to collect this data, and we have to create a data lake for that, actually, right? Because if we don't have those information with us, actually, we won't be able to get the output of that, what is needed for the community, actually, right? So that is a challenge for us. How are we going to do that, and how we are going to collect this data, where this data is going to come from, actually, and then what data is being will be connected to what kind of information and source actually, right, to in order to help the community actually, right. So I was talking about a particular example is that, when I go to a doctor actually, any doctor that I go to, if you are a new patient, you will be given at least 4 kinds of forms to fill out every time you go basically. And in that form, there are 5 times, at least 5 times, that they will ask you that same information in a different kind of form actually, which is in 2021 we are still doing that same paperwork and ridiculous amount of information, that everybody has to go through and write it in, with a pen or pencil actually, right. They don't even have any kind of magic a device that would say, okay, Mr. Khan, come here, actually we'll just scan your ID and your information, we'll have your information, right. And the thing is that, once I'm done with the doctor, and if I go to another doctor, he doesn't even know what I was treated for into that other clinic actually. So they have to transfer everything, every information that I had in that clinic to that other place, and that is probably physically or by mail or by feeding the fax machine with a lot of information, and it will go to that particular doctor, right. I mean, we are living in 2021 actually, right. And with this information technology and advancement of these old things that we have, our healthcare system, it looks like we still is in 1885 actually, right, where we used to write things and give it to the doctor, and then they will do their stuff, and then you go to another doctor and stuff like that. So I think there's a need for such kind of things to revolutionize this whole process by creating some kind of a digital ID, basically, right? That you create, just like your driver's license. There should be like some kind of a, I would say like a bank debit card, right? So when you go to your ATM, you put your information and you put your passcode. It gives you all the information that you have, right? So I think that particular thing for every healthcare should be centralized, or some kind of information has to be gathered somewhere, basically in a cloud. We have tons of cloud basically, and there's tons of data that you can store, petabytes of information, and that data will be shared, will be a digital key for that particular patient actually, and we can create these kinds of banks basically for different healthcare providers, that they will be the guardian of this particular information for this particular patient, and they will be able to, the patient is the subscriber who will go and hand this information to anybody that they want, and then when they scan this information, they will get all this stuff, right? So I think we need to do a lot of work actually on this thing, and building this system. But I think we can start with at least gathering the data and information, which I think we still lack actually a lot of things. And again, the transparency is all built on what data that you are collecting actually, right? And how you will be joining all these different towers actually, the healthcare industry. So thank you again, and hopefully we'll work together to accomplish something that is needed in the in this time frame. And inshallah, whatever help is needed, I'll be there to sit with all of you and design something that will be effective for all of us.
Yeah, many Jazai Khairan, Brother Imran, for joining us today as a subject matter expert on information systems. And we welcome some of the people who have actually joined us recently as subject matter experts, and bring in the depth, the in-depth knowledge in their field. And we want to design a pathway with and in a nutshell, there is only one basic thing. What do we want from the healthcare system? That's it. But I think having that clarity of intent and being accountable to ourselves, and while keeping the eyes on the big picture, is going The government is doing the job and trying to decrease complexity through accountability, and we can even ask more. But what we personally need is we need to increase the systems literacy on our end. And Dr. Kamal really mentioned this beautifully. Thank you. Yes, there's a clarity of intent, and there's got to be that they must translate into clarity of actions. And that once you translate your actions based on your intent, that's when you get the clarity in the message. And sometimes, and this is literally a path, and it creates successful engagement. So when Picori mentioned that the successful engagement, the caveat to successful engagement is clarity, I said, really, clarity? Clarity in what sense? And this is what we have come about in past 5 months, actually. And I have seen that as we moved forward, our messages has become clear. And it all started with that clarity of intent, which actually, and then we had to align that up with the clarity of actions and the clarity of message. At the end, I want to say that, clarity of intent, really, that's the bottom line. Innamal amalu binniyat. I mean, we have read this, heard it, taught to us when we were maybe 5 years old. But after 50 years, I'm now coming to understand what really it means. And with that, I'm just going to say that we actually practiced it. Now we have started to practice it, and we have put out our project documents are online. The project EMPART is open to public. So we have in-depth information on many of our information system resources. So please explore those whenever you have the time. A quick thing would be the leadership read on the 8th habit. All of the principles that we are exploring, they are really building the leader within us. And the 8th habit of Covey says, this is by the way, it was the last book by Stephen Covey. And now his organization is being led by his son, who's also named as Stephen M.R. Covey. So the 8th habit says, find your voice and inspire others to find theirs. But we cannot find our voice unless we are clear in our intents. So I'm going to give a few minutes back to you guys for the Q&A. Thank you again for everybody to joining us, and I'm so honored to be a part of this event with all of you. Thank you very much.
Thank you. We have one question in the chat from Dr. Johnson. Do you think healthcare systems are too complicated to be bridged? Community orgs don't always have the same capacity of hospitals. Should we start with where the community orgs are? Find out what the organizational picture looks like from the community or from the patient record. I think this was addressed to Brother Imran.
Sorry, what was the question again? Sorry, I'm reading Rebecca Johnson's question. Actually, I think it says that
yes.
Do you think healthcare systems are too complicated to be bridged? Community orgs don't always have the same capacity of hospitals. Should we start with where the community orgs are? Find what the organizational picture looks like from the community. Right. So yeah, from the patient record perspective, right? So the systems in the healthcare industry are not complicated. We have made it complicated. It's not complicated. I have worked in the hospitals. I have worked in the pharmaceutical industries as well, right? The thing is that the system that they are using is very old, actually, right? Some of their infrastructures are very, ancient kind of stuff, and they don't want to upgrade those systems, and they don't want hospitals, and when you talk about upgrading their systems and making it modernization and all those things, they just hesitate to do that, actually, right? They just want to say, hey, things are if things are not broken, why fix it? Basically, that's what their approach is, actually, right? The thing is that if you look at individual level of healthcare providers, like doctors and the groups, the medical groups that we have, if you talk to them, I think they will be able to open to the suggestions and say how we can bridge this gap, actually, and who's going to perform this, actually, right? And again, the the security and all those things will definitely come up. But before you pitch them, you want to make sure that all your things are covered into that whole presentation. But I don't think that it's too complicated. It's just that it's willingness basically to do it. Yeah, I don't see the willingness to do it actually. It's, keep it like this for now, kind of thing. I hope I answered your question.
We have another question by Dr. Johnson for Dr. Amina, I believe. The inaccessibility of care from university hospitals who are conducting clinical trials is something I hear a lot. What, if anything, do you think patients should do when they have heard about a treatment, but their insurance doesn't provide them with care, which includes the portion of access to a trial or treatment? Dr. Amina? You're muted.
Okay, I think that Hira answered that question kind of.
Yeah, that was for me, and I answered it.
Oh, okay.
Hello.
Any other questions for our panelists?
Hi, it's Nancy. I can't type fast enough for my question. My apologies if it's noisy here. We have some guys chipping the ice off the roof, so if it's a little noisy, that's what's going on. And I have a question for Brother Imran. First, I wanted to say thank you to all the speakers. It was really an interesting way to spend the afternoon. Sincerely, it was really, really, I love that Sister Fatima has these set up because it's really causes you to have a lot of thoughts and inspirations as you go through your day. And Saturday afternoon is a nice time to do that. So my question is, as a health systems, I know that the systems that I'm involved with for healthcare of myself and my family, they're a little bit more progressive where you sign in once and then the next time you don't even have to sign in again because it's electronic. And some of the women's centers are now having the notebook where you sign with a pen, electronic pen, but you do have to do it every time. Right now, the Muslim community, I hate to see them become siloed. I fear that that will be happening, but I'm hoping that it's a bridge as our population that seems to be primarily immigrant is a little hesitant, a little bit in need of more trust before they're better prepared to go into the health system, except for the ones who have family members who are physicians. There is that population, but a lot of what I'm seeing in community health is a form of siloing, where the Muslim are more comfortable with going to clinics or talking to people within their own community or seeking help within their own community, which has its advantages, but also there is some risk of siloing. But because that reason we're so in many of these areas, I really like the concept of infrastructure from an IT perspective. We have an opportunity to build it because we're at the ground level. And what I'm seeing instead is that we have a lot of free clinics popping up with no central authority, and they're all using their own regulations, which some of them aren't using full policies as they should be. There isn't the sharing of the documentation like there could be, and advantages to get the data on our own community. It seems to be what we really need to put the horse before the cart. So again, to your statement that how do you get people on board? How do you get buy-in for communities to see the value in doing that is a challenge. But right now, that's right where we are. If we could put it in place first, we would be able to do so much. What do you think about that?
Well, again, I think that it will again will start with the community actually, right? What the people like, as you said, a Muslim person probably would see some Muslim doctors in the community, then they will go over there because they will feel comfortable actually, right? Without reading their credentials, what this doctor does and stuff like that, right? I mean, they don't have the data, but they will definitely go, because their name is Muslim and stuff like that, right? I think the education and the awareness has to be not only done through the mosque or masjid, but overall, like we should have like seminars and some kind of a webinars, basically, right? To bring people actually and at least ask their problems, what their problems are actually, right? I mean, if you have to know what their problems are. If you don't know the problems yet, then there's no transparency actually, right? So there has to be a transparency of the person who has the problem, who's going through all these things actually, right? And then see, okay, there are different verticals of the problems there might be, right? And you need to just gather that data and analyze that okay, how can we fix these issues and problems and where the problems are actually, right? And then you start getting into that infrastructure build, that if we build this kind of things, then we will be able to address these issues. So I'm sure you have heard about the blockchain technology, right? And it's a trusted system between different parties. Basically, they work together, just like the bitcoins, and you have heard about the bitcoins and stuff, right? How the ledger system works, basically, right? So I think in the healthcare industry also, these things has to be evolved actually, and different parties should work together, for the benefit of the patient actually, I think that.
Yeah, I really recognize key players in the community attending at events like this through Worry Free. And I really do see CIOGC as integral to forming the guidelines for free clinics in the Chicago area and for other programs in the community. And then someone like you to help everyone get on the same page with their IT systems and their EMRs. I think it's imperative. And all of this, the way that things are coming up siloing, has got to do with the way our community is decentralized, and all these grassroots intentions are pure and really good intentions. Without that central nature, we're going to be spinning our wheels.
Exactly. I mean, I'll give you an example that, take one EMR system within this whole US actually, right? That is compatible with the other EMR system. That's the problem. There is no API. There is nothing that can talk to API to EMR system, can even talk to each other, right? They will make it so proprietary that only that particular system is going to be used by its own actually. And if you do not fix that actually, then you won't be able to fix anything actually.
That's right. And we're at a place where we're perfectly positioned to start from the ground roots. So we have to get there in order to do it before everybody grows too fast in opposite directions,
Just a note that we are now past our original our time, but if folks can still stay on, we have a couple more questions. I think Dr. Dean had her hand up, and then Sister Luma.
No, this is in response to Nancy's issue, and I agree with her wholeheartedly. I'm working on a volume now on Muslim healthcare professionals during COVID. And we found one of the researchers contributing has said, there are 70 plus a few Muslim-owned or operated healthcare centers across the country. Only 2 of them are FQHIC. And when we went back to find out how come, it was the Muslim healthcare professionals and administrators who did not want to go through the transparency necessary to become a federally qualified health center where there are metrics in place and all kinds of things. They wanted to be on their own, doing what they wanted to do, when they wanted to do it, and how they wanted to do it. I think what they're missing is that eventually the federal government is going to turn a magnifying glass on them. And if they're not meeting some basic standards, they will be shut down.
That's exactly my thought, exactly. And especially, particularly, I was concerned over the last presidential administration because we are Muslim. Because we are Muslim, we need to hold ourselves to a higher standard, not a lower one.
But we don't. Just a different standard.
Can
And
I
also,
go
if any of you like to write to contribute to that volume, please do contact me. Worry Free Clinic is already on board. The rest of you, we would love contributions.
I know we're a little short on time. Do you mind if I intrude just for 2 minutes? Thank you so much. First of all, I love the speakers. Thank you everyone for all your input. It was amazing. If it's okay, if we could reach out to you after the meeting, I just have so many ideas. I promise I won't tell them all right now. But one thing that struck my mind was, Dr. Imran, your work is amazing and so relevant because as you said, there is not like a card, and it's surprising that in Europe, there are countries that already established a card, and it's so important, especially when you go, like these patients go from pharmacy to different hospitals, or like primary care physicians. People change that sometimes once a year, once every few years. Even they change insurance plans. So it's so important that they have that. It makes the job of a provider easier, and also clinical pharmacists as well when they want to treat these patients. So thank you so much for that. I also want to quickly mention there's this new thing that they're using where like the GPS mapping or a Google system where they're trying to like see a more in detail or in depth the different types of locations of providers with respect to these different areas, and they're actually using it to change policy. Because with that information, they start noticing that there aren't enough pharmacies or providers or clinics in these certain areas, and they go back and they get funding for these certain locations. So, Dr. Imran Khan, do you think that your work will expand to include such information in your cloud and in your architecture of the data? Would be able to start seeing these types of more regional locations, and so we can better strategize resources for underprivileged communities. I'm done. Thank you. If you have any feedback.
Yeah, I mean, I'm sure Google must be doing it for a certain particular reason actually, and Google is very advanced in capturing all these data and collecting all these data actually, right? But again, it's Google's proprietary data actually. So what Google does is on its own actually, right? And you cannot just go and ask, or maybe they will publish that data if you ask them, and they will get you that data for a price or something, right? But yes, I mean Google will, if Google publishes those data and stuff, and we take those data and incorporate that within our system actually, and see what we want to do with that data, definitely we can do that actually. It's not an issue. It's an age of information actually, right? The more information you are gathering, you will make more sense out of that. Okay, what you want to make the sense of that data actually, right?
Thank you, brother. Appreciate it.
Thank you.
Well, many khairan to everybody for joining us. Like we said, we went over time, but there's just such a rich topic, and I think this really stimulated a lot of discussion. So I hope we can continue these discussions going forward with all of you. And with that, we'll sign off. Inshallah, we'll see you next month, I think, for our next meeting. And please stay in touch.
All right.
Thank you.
Thank you so much. Assalamu alaikum.
Walaikum.
Thank you.
Thank you.
Yeah.